I'm Dr. Gary McCarragher. I'm a hospice physician in Florida. I'd like to review some basic misconceptions about hospice. Admission to hospice is permanent. Once admitted to hospice, patients can never go back to aggressive treatment of their disease. This is false. Patients may at any time discontinue hospice services for any reason, including a desire for aggressive treatment such as chemotherapy. If at any time a patient wishes to resume hospice, no problem. They can always be readmitted, provided they remain hospice eligible. That is, they have a terminal illness with a prognosis of 6 months or less. Hospice patients are required to sign a Do Not Resuscitate DNR order, are not permitted to call 911, visit the ER, or be admitted to hospital. We do carefully review the risks and benefits of CPR with our patients, but our patients are under no obligation whatsoever to sign a DNR order. Given their circumstances, most of our patients already have a DNR order signed prior to joining hospice, or sign the DNR shortly after joining hospice. But some don't, and that's okay. Calling 911, visiting the ER, or admissions to hospital are certainly all permitted. Having said that, we do strongly suggest that our patients call hospice as soon as possible should some crisis occur. Oftentimes an emergency nursing visit to the home or the chronic care facility can take care of the problem and eliminate the need for hospitalization. Only patients with a terminal cancer are eligible for hospice. Any patient with a terminal illness and a prognosis of 6 months or less is hospice eligible by definition. In the early 1970s, during the infancy of hospice in this country, most hospice patients did have cancer. However, that demographic has changed. In 2009, only 40% of hospice patients have cancer. Currently, most hospice patients have some chronic benign condition, such as end-stage lung disease, heart disease, or Alzheimer's.